Hey everyone, welcome to GrowMed. If you're new to GrowMed, subscribe to GrowMed and tap the bell icon so that whenever I post a video, you will get a notification. So in this video, we will look at some highlight points, the national health programs and the points related to them. So this topic is a must-do topic and questions are asked on this, image-based questions are asked and the questions on the policies are asked. Okay, so now one by one we will look at the image along with the questions which are asked. So the first image, as you can see here, this image is of the midday meal scheme, and the question asked repeatedly from the midday meal scheme is how much nutrition does it provide? So it will be providing calories one third and proteins half. Okay, so it was asked as a one-liner in most of the exams. Then Suraksha Clinic, which is used for the sexually transmitted infections. Okay, and in that we will be treating the person using certain kit. So one by one we will look at those kits also, and the main important thing is the logo. So this logo is of the Suraksha Clinic, and we have 7 kit in this. So based on the symptoms of the patient, we will be treating them accordingly. Okay, and every year one question from the Suraksha Clinic is a must. So these 7 kits along with the disorders used for it, you need to know. This kit 1, it is the gray color kit, and this is used for the treatment of the urethral, anorectal or the cervical discharge. Then kit 2 is green color, and it is used mainly for the vaginal discharge. Then kit 3, the white color kit using for the genital ulcer which are non-herpetic. Okay, so you need to focus more on this part, that non-herpetic ulcers, they are usually treated with the kit 3. Then kit 4, which is the blue color, and genitic ulcers which are non-herpetic but the patient is allergic to the penicillin, then we will be using the blue color kit. Then kit 5, it is the red color kit and using for the genetic ulcers which are herpetic. Then kit 6, it is the yellow color kit and used mostly for the PID, pelvic inflammatory disease. And this is a repeat question asked multiple times. Okay, so a female coming with the complaints of lower abdominal pain and vaginal discharge. So which of the following kit you will be using? So we will be using the yellow color kit. Then black color kit for the inguinal bubo. So along with the name, color of the kit and used for the disorders, you should also know the content of the kit, which kit contains what medicines. Okay, so questions can be asked on those medicines also. Then moving on to the next image, this is the ESI Act 1948. So this is the logo of the ESI Act. So questions are asked on the chairperson. Who is the chairperson of the ESI? And it is the Union Minister of the Labor. And repeatedly questions are asked on this contribution. Okay, so how much a employer will contribute? Then a employer will be contributing 3.25% of the salary, and employee will be contributing 0.75% of the salary. Then questions are also asked on its benefits. Okay, so in this act, the patient will be getting certain benefits like the sickness benefit, the extended sickness benefit, the maternity benefit, and there's also another benefit, that is the direct benefit, in which the patient doctor will be directly treating to the patient. Okay, then in the sickness benefit, 70% of wages, the patient will be getting more than 70% of the wages for the 91 days. In the extended sickness, the patient will be getting 80% of his salary for more than 2 years. And maternity, question are asked repeatedly on this maternity, and it is the 100% salary for the 26 weeks or 6 months. Okay, and it is like divided into pre-pregnancy and post-pregnancy. Okay, so 26 weeks from the pregnancy and until 6 months after the pregnancy. Okay, then another very important program, that is the NVB DCP. Okay, so this one is for the national vector-borne diseases, and the question is asked, uh, which all vector-borne disorders are included in this. Okay, so image can be given of this, and you question can be asked, this program includes which of the following. So it includes 6 disorders: malaria, filariasis, dengue, chikungunya, Japanese encephalitis, and the kala azar. Then moving on, the NLEP, this one is for the leprosy. Okay, and in this scheme, leprosy patients are divided into the categories, the PBL, possibacillary, and the multibacillary. Okay, and based on that we will be doing the treatment. So according to the new guidelines for PBL also, we will be using the 3 drugs, and we will be using it for the 6 months, and for the multi we will be using 3 drugs for the 6 months, that's on rifampicin and the clofazimine. Okay, so these drugs and the duration of the treatment you need to remember. Then moving on, this program, this one is for the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disorders, and the Stroke. So, in this program, you will be integrating the DM, CVS, and the stroke with the cancer. So, questions can be asked giving this image, and can be asked which of the following or all of the following disorders are involved in this program except. So it will be diabetes mellitus, CVS, stroke, and cancer control. Then moving on to another very important program, the anemia mukt bharat. Okay, so every paper anemia mukt bharat question is a must. So you can mark my words, one question from the anemia mukt bharat is a must in every paper. So this table you will learn, and 1 mark is sure, 1 mark confirm you'll be getting. Okay, so it will be including 6 beneficiaries, 6 intervention, and 6 institutional mechanisms. And this is the age. We will be giving 2 supplements in this, the iron and the folic acid. So you need to remember the dose of the iron and the folic acid and the duration. That is weekly, bi-weekly, daily. Okay? And the pregnant woman, this one is a must. So this question is repeatedly asked from the Anemia Mukt Bharat, and this was asked in the recent Jan 24 also. Okay. Then the next program, that is for the vision control, and in this the question can be asked based on the definition. Okay, and definition of the blindness, and it is less than 3 by 60 in the better eye. And in this program, blindness is again classified into the 3 categories, that is the social blindness, economic blindness, social blindness, and the manifest blindness described. And the definition of the economic blindness is a vision in the eye will be less than 6 by 60 and between 3 and less than 6 by 60. Okay, then social and the manifest blindness. Okay, then moving on to another very important image, that is the TB. So TB की treatment, TB की features. So TB का question ना आए FMG में, ऐसा हो ही नहीं सकता. So you need to look at all the points regarding the TB. And TB is a disease that comes in medicine, in surgery, in PSM, in the pharma, the drugs, pathology. Okay, so TB फैला हुआ है हर सब्जेक्ट में. So TB के questions is a must. So you need to look at all the points regarding the TB. Then let's look at one question from the PSM, that is the DOTS treatment. ठीक है, so it is the directly observed treatment and short course treatment, and the diagnosis in the DOTS is based on the sputum smear. So asked as a one liner. Then in this DOTS the patient receives 500 per month, and we will be also treating the drug resistant TB in this. So these were certain points which you must remember from the DOTS. Then this Nikshe, it is an ICT based surveillance system, online monitoring for the TB patient. Okay, so this can also be asked as an image based question. So that's it in this video, guys. This were a short video on the list of the important national programs. I will try to post the part 2 video on this soon. So this is a short video, more likely it will be helping you in your revisions, last moment revisions. Okay, so thank you so much guys for watching this video. Like the video, share it with your friends, and subscribe to GrowMed. Thank you so much for watching. Bye bye.